After graduating from dental school, I figured out how much I didn't know. I learned how much was out there, how much dentistry could offer patients. That really kind of began my journey into implantology. So after a number of years and a lot of continuing education, I became a board certified implantologist. I earned a fellowship and a diplomat with the ICOI, which is the International Congress of Oral Implantologists. And what that means is we spent hundreds of hours in continuing education. We've gone all over the world to perform live surgeries. When we go to these places, these university settings, we're able to work with some of the top implantologists in the world. People like Maurice Salama from Atlanta, who's a board certified periodontist and orthodontist. People like Howard Gluckman, who's a famous periodontist from South Africa. These are two doctors that have done tons of research together. And to be trained by these two personally has been career changing for me. One of my favorite places to go is Santos, Brazil. There's a university down there. It's not that far from Rio. The Brazilians down there are doing cutting edge surgeries. They're doing things that haven't been tried in the US yet. We're pushing the envelope of what we can do surgically to restore people. So not only are we placing tons of implants, but we're doing great things with guided bone regeneration, bone surgeries, soft tissue surgeries. We're trying to give them everything we can give them while we're down there. And the best part is, everything that we do down there, I can bring back to this practice and help my patients. One type of surgery we did that really sticks out in my head is called partial extraction therapy. It's a little nuanced, but what we do is we don't remove the entire tooth. We leave part of the tooth root in the mouth, place the implant behind the root, and we get zero bone resorption. Anytime a tooth comes out, the bone's going to resorb a little bit. If we leave part of that tooth in, the bone is never triggered to resorb. So we keep the bone without having to do extra bone grafting. And what we did with that case is we placed the implants immediately. They went in same day, and the patient got brand new teeth without a lot of extra bone grafting or bone surgeries that weren't needed. So when I started learning about implants, I took the Carl Misch course. Now, Carl Misch was a general dentist who literally and figuratively wrote the textbook on implants. He started working in Sweden with Dr. Brandmark, and he's been a pioneer in the industry. Now, unfortunately, Carl Misch has passed away, but I was his second to last class to hear him lecture before he passed. So after completing all of the Misch courses, I earned a surgical fellowship. What that course gave me was a solid and proven method to place implants predictably. After that, I did complete a 300-hour externship from NYU Stony Brook, and I've also become a fellow and a diplomat in the International Congress of Oral Implantologists. So with becoming a board-certified implantologist, that just means you've completed hundreds of hours and life surgeries that give you hands-on knowledge of every aspect of surgery. With this type of setting, we get one-on-one hands-on training from some of the best implantologists in the world. And so we've come back and we've been able to place hundreds of implants and change lives. We're able to perform all aspects of implant surgery. If you need one tooth replaced or an entire mouth, that's something we can do predictably. As long as patients follow the regimen we use, we can keep success rates incredibly high. So if you're looking for a way to replace teeth, or you're interested in implants, give us a call. We'll help you out any way we can. But we will take the time to sit down with you, answer all your questions, go over medical history. We'll show you three-dimensionally what the implant will look like, and we'll come up with a customized treatment plan for your needs and maximize your chance of success.